Hi, everybody, and thanks very much to the ICPN team for asking me to come along and speak to you today about tobacco and e-cigarettes. What we'll do is we'll have a look at what tobacco smoking and e-cigarette use looks like in Ireland today. We look at the harms associated with both, and we look at how people can successfully quit smoking as well. So, smoking, not a big deal anymore. Nobody does that anymore, right? Well, the Healthy Ireland survey, most recently from 2024, which is a survey of adults aged 15 plus in Ireland, tells us that 17% of adults, that's people aged 15 plus, are still smoking in Ireland today. Now, the good news is that has come down from 23% in 2015. So we've made good progress over the last 10 years, but you can see there that from 2019 to 2024, we've kind of hit a wall and there's a bit of stalemate at the moment. So we do need to work harder to get our prevalence rates down to 5%, which is our government target in order to be a tobacco-free Ireland. Um, that 17% equates to roughly around 700,000 people in Ireland who are still smoking today. So that's 700,000 people who are at risk of developing avoidable, preventable diseases and unfortunately dying earlier than they should. In terms of men and women, more men than women smoke in Ireland. So 20% of men aged 15 plus smoke, that's 1 in 5, compared to 15% of women, which is 1 in 7. The highest prevalence that we see is in the 25 to 34 year age category. So 20% of people in that age category are smokers. And we see that more people who are unemployed, 25%, smoke than people who are employed at 18%. And we do know that smoking is very concentrated in disadvantaged areas, that people living in these areas are more at risk of developing tobacco-related diseases. And a lot of the work of the HSE through the Sláinte Care Healthy Communities programme in recent years has been designed specifically to target people in those areas to try and bring that tobacco prevalence down. In terms of what smoking looks like in children, the Health, Behaviour and School Age Children Survey tells us that children aged 10 to 17 whoever smokes cigarettes has come down since 2018, so 12% and down to 9%. So these are children that have ever tried smoking a cigarette. And then we classify current tobacco smoking as being somebody who has smoked within the last 30 days. And that's declined from 6% in 2018 to 5% in 2022. So good news, but there is some concern that the proliferation of e-cigarettes is actually renormalizing tobacco use in our society. And we might look at that in a little more detail in a little while. So look, we don't need to dwell on this for too long. You'd be hard pressed and have to search long and hard to find someone in our society who doesn't know that smoking tobacco is incredibly bad for them. It raises your overall cancer risk almost everywhere in the body. It increases the risk of heart attack and heart disease, causes irreversible lung damage, such as lung cancer and emphysema, whole host of diseases and problems associated with tobacco smoking, and incredibly damaging on the body. Tobacco use causes 4,500 deaths in Ireland every year. That's over 12 deaths every single day. And the sad thing about these is that they're all preventable and avoidable. 22% of all deaths from cancers are related to smoking. We see 44,000 smoking-related hospital admissions to Irish hospitals every year, and this translates to over 300,000 inpatient bed days that are used to treat tobacco-related disease across the health service in any given year. To put this into context, that would compare to the likes of St. James's Hospital in Dublin or Cork University Hospital, doing nothing but treating tobacco-related disease all day, every day, all year, every year. So there's a huge amount of capacity taken out of the Irish healthcare system due to tobacco-related disease. Treating this disease costs the health service directly 460 million euros every year. And interestingly, 55% of litter, the EPA tells us, is cigarette-related litter. It'd be interesting to see this updated to include e-cigarette related litter, because you'll have all have seen news articles, etc., on disposable vapes being disposed of incorrectly in Ireland and actually littering due to e-cigarette use. So we might move into talk about e-cigarettes for a little bit, seeing as we've mentioned them. So what are e-cigarettes? Well, essentially, they're an electronic nicotine delivery system, and they're designed quite specifically to do one thing, to deliver nicotine to the human body. 99% of all the e-cigarettes you'll find on the market will be nicotine-containing devices. We've had them in Ireland as a consumer product now for about 20 years. They would have started off as quite rudimentary devices like the ones you'll see over here on the left-hand side of the screen that were designed to, almost look like conventional tobacco cigarettes. They were a bit clunky and they weren't very good at delivering nicotine, but they've gotten much, much better and effective at delivering nicotine over time. So you'll all have seen these tank style vapes, like the large one in the middle here. So these are rechargeable and refillable. And then in more recent times, disposable vapes have become very, very popular in the Irish market, and they're particularly popular among children and young people. The main reason being because they're cheap, they're easy to hide, and when you're finished with it, you just throw it away. So who is vaping in Ireland? So the Healthy Ireland survey tells us that 8% of adults aged 15 plus are using e-cigarettes. That's up from 3% in 2016. And we see the highest use then in people who are under 25 years of age. So that increased from 10% in 2022 to 18% in 2023. Among children and young people, the Health Behaviour and School Age Children in Ireland study tells us that 9% of 12 to 17-year-olds identified as being current e-cigarette users in 2018, and that increased to 13% in 2022. And a different study then, a study called SBAD, which looked specifically at 15 and 16-year-olds, reported that e-cigarette use was up from 1 in 10 in 2015 to 1 in 5 in 2019. This study is currently being updated, and anecdotally, we would hear that that prevalence has increased again. So there's a worrying increase in the trend of e-cigarette use among children and young people. So what's in e-cigarettes? What's in the aerosol? And it is an aerosol. Even to call it vaping doesn't really accurately describe what somebody is actually doing, because it's not a vapor. An aerosol implies that there are small particles within the fog or smoke, if you want to call it that someone is actually inhaling. So the aerosol does contain volatile organic compounds. So these are chemicals that change when they're heated. You'll find heavy metals such as nickel, tin, and lead flavorings and chemicals that can be linked to lung disease, some carcinogens, ultrafine particles in the aerosol that the user is inhaling deep down into their lungs. And then, of course, nicotine, the ingredient that makes these devices so addictive. In fact, all of these chemicals that are scrolling onto the screen have been identified in e-cigarette aerosol. And the ones then that are highlighted in orange are recognized by the Food and Drug Administration in the US as being chemicals that are harmful to human health. And again, all of these have been identified within e-cigarette aerosol. So look, what is the evidence of harm due to e-cigarettes? So I suppose the Tobacco Free Ireland programme, we were developing clinical guidelines. These are a set of instructions and recommendations for clinicians and healthcare professionals to help people to quit smoking effectively back in 2020. And we needed to look at whether or not we were going to recommend e-cigarettes as a tool to help somebody to quit smoking. So in order to do that, we needed some evidence. So the Health Research Board conducted an evidence review for us, and they looked at three things. They looked firstly at whether e-cigarettes were effective to help people to quit smoking, and they found that e-cigarettes were no more effective than safe nicotine replacement therapy to help people to quit. They also looked at the harms from e-cigarettes, and they found obviously nicotine dependence. These are nicotine containing devices, so somebody who is using them is at very high risk of becoming addicted to the product, addicted to the nicotine. They found early evidence of damage to the heart and circulatory system, early evidence of harm to the lungs. You'll have seen on the previous slide the whole host of chemicals that can be found in the aerosols, some of them identified as being carcinogens, and then more unusual things like injuries and poisonings. So these would be things like blast injuries where a battery has exploded in somebody's hand or their face or burnt them through their pocket, and poisonings, so things like children who have ingested the actual e-liquid and become sick having done that. So definite harms from e-cigarettes. And then the Health Research Board also looked at whether or not there was a gateway effect for young people to transition from e-cigarettes to conventional tobacco smoking. And what the review found was that children and young people who used e-cigarettes were 3 to 5 times more likely to actually start smoking conventional tobacco than young people who didn't. So obviously we're concerned now about the proliferation of e-cigarettes in our society and the potential for this to renormalize tobacco use and ultimately undo a lot of the good work that we've done in bringing the number of children and young people who smoke tobacco down. It's worth looking at some old ads for tobacco products. So this is an ad from Murad cigarettes from 1919. You can make up your own mind about whether Santa Claus is meant to appeal to an adult or a child. But this is a newer e-cigarette ad from the last couple of years. So this is the tobacco style advertising taken forward into the future, and it's eerily similar. And also then in the social media age, we see companies like Juul who are using this type of advertising, particularly to target young people. And then you have these older type of cigarette ads as well that portrayed smoking as being sexy and attractive. Another one here. And then notice how the new e-cigarette advertising mimics the old tobacco advertising. And in fact, some of the e-cigarette manufacturers are actually owned by the tobacco industry. So the industry has become a bit interchangeable, and the old tobacco advertising playbook is very, very, very much in use here, and it's specifically designed to target children and young people and get them addicted to these products. The use of flavors in e-cigarettes is then also very attractive, and it's specifically designed to appeal to children. The devices are almost displayed or portrayed as being harmless. And then these newer disposable type devices, you'll notice the fruity, fresh feeling that resonates through the advertising, again, specifically designed to appeal to a young person. So what's been happening in the e-cigarette space legally? Well, the Tobacco and Nicotine Inhaling Products Act was passed at the end of 2023. So what this does is it introduces a licensing system to sell e-cigarette products. So as of 2026, vendors that want to sell e-cigarettes will have to register with the HSE, National Environmental Health Service. They'll also have to pay a registration fee. Importantly, it prohibits sales to children to under 18. So it is now illegal for an e-cigarette to be sold to somebody who's under 18 years of age. And it prohibits sales at children's events, and it prohibits advertising in certain places, such as on public transport and in cinemas. What it doesn't do yet is control the content of e-cigarettes, such as flavors. It doesn't control the packaging and naming of products, and it doesn't control point of sale display. So packaging and naming, you'll notice with tobacco products now, everything has to be in a plain packaging. Branding can't be visible on conventional tobacco products anymore, and they're not allowed to be displayed behind the counter in places where they're sold. This doesn't yet apply to e-cigarettes, but these are all other areas of legislation that the government are actively looking at. Just to bring us back, I suppose, to treating tobacco addiction, what the HSE does and how somebody who smokes might successfully go about quitting. Well, the HSE offers behavioural counselling and support to anybody who wants to come to one of our stop smoking services. So what that involves is somebody will attend either face-to-face or over the phone, 9 appointments or more over the course of 12 months, where they will work one-on-one with a stop smoking advisor to identify why they want to stop smoking, their triggers, coping mechanisms, and they'll be guided through their quit journey, essentially. And we also recommend that somebody uses stop smoking medication in the form of nicotine replacement therapy. And we recommend that somebody might use combination nicotine replacement therapy. So that would be a long-acting form of NRT, like a patch, and then combine that with something short-acting, like a spray or a gum. The idea being that you put your patch on and you get a nice, slow, steady release of nicotine throughout the day. The level of nicotine that's being given through the patch is much, much lower than somebody will have been getting when they were smoking cigarettes. So you may still get cravings, but you can kind of top up on the nicotine during the day then by using a gum or a spray to kill the cravings as they happen. And nicotine replacement products are now free to anybody who engages with the HSE Stop Smoking service. So you can get a 12-week supply of nicotine replacement therapy completely for free when you come to see us at one of our stop smoking services. So how do you access our stop smoking services? Well, I suppose a good first port of call is to go to www.quit.ie, where you can access phone support. You can also sign up for a free online quit plan where you can track your progress, or you can come to one of our face-to-face stop smoking clinics that are located all over the country. In fact, we have stop smoking clinics now in every county in the country. Our services were greatly expanded through this Launch Care Healthy Communities program. A couple of years ago, we almost doubled the number of stop smoking advisors that we have working in Ireland. So we have complete national coverage with face-to-face clinics, and they're all available on www.quit.ie if somebody wanted to go and filter by county and find the nearest stop smoking clinic to you. We know that people who use HSE stop smoking services are twice as likely to quit smoking for good than if they try to go it on their own. And the good news is that if you stop smoking for 28 days, then you're actually 5 times more likely to be quit for good. So I think that's the take-home message, that there is help available. Our HSE services are very, very good. They're very, very effective, and we would encourage anybody who would like to quit smoking to come and see us. Our email address here is TFI, that's for Tobacco Free Ireland, at hse.ie, if anybody would like to get in touch, and I'll be around to answer any questions that people might have at the end of the webinar. Thank you.